The safety and security of medical professionals and patients is once again in the spotlight. Last week, eNCA reported on assaults on women while on duty in hospitals. Now, the South African Medical Association is holding a briefing on this matter. Well, before that, senior reporter Aviwe Mtila has been speaking to professionals and unions in the space about what they would like to be done in order to protect healthcare workers and patients. Aviwe, good afternoon. Thank you for joining us here on the lead. Just take us back to when you spoke to a doctor, for example, I understand, who was assaulted.
So the South African Medical Association holds this press briefing, but at the backdrop of that very story that we did last week, visiting the doctors, where we got a glimpse of the abuse firsthand, of how they're abused by patients. So we visited a number of doctors who told us of how they are thrown with urine, the verbal abuse, and sometimes even physical abuse, and a lot of it coming in on the weekends when the patients are drunk, coming back from those fights and brawls that they'd had at their incidences, taking them into the hospital. So as we were leaving, visiting a number of doctors, we were called back by one of the doctors, Mandisa Kubeka, Dr. Mandisa, telling us she had just got assaulted some 10 minutes ago. So we rushed back and she detailed her story of a patient who hit her with a patient file, then went on to throw a storm, basically, swearing at her. This is her incident that happened moments before.
The guy, he stormed, he kicked the box. The sound, it sounded like it was a gunshot. I was scared. I didn't want to be here anymore. I don't want to work under these conditions anymore. When is anyone going to hear me, hear us? I showed him, guy, there's a notice. It's not from me. It's nothing personal. But still, he had the audacity to insult me for something when I was right.
What was he doing? This is 20-something.
We all are carrying files. He hit me with the file. He was banging it on the desk, and then he walked past me and kicked the box, swearing at us.
What's the way forward now? Is the police involved, or what's going to happen?
As far as I'm told, he is being detained somewhere by the guard room or something. Police have been called. We don't know whether they were going to come or not. I have to write an incident report and give to the facility manager. Then sizobona ke ukuthi if something is done.
Before I ask you about what is the South African Medical Association saying, in that clip that you've just played for us that happened earlier, she said the person in question was in some guard room and they were waiting for the police. Have you spoken to Dr. Mandisa since to find out what actually happened there? Can you share that with us?
I actually had a phone call with her about an hour ago where she tells me that she went to the police station to lay a case and the police refused to open a criminal case. She says she's been living in fear, and since that in particular incident, she now has to be transported by her partner to and from work. She's afraid if the patient might retaliate, given that this has opened a nationwide spark, basically highlighting the plight of the abuse of doctors. So she's living in fear and she's hoping that things will change, but the scary part is that she knows that nothing will change at this stage.
Yeah, I mean, you heard her saying there, I don't know if the police will come. Okay, the South African Medical Association, you've been talking to them. What are they saying?
Well, they're saying that this is an issue that's been in the medical fraternity for years. In fact, they've been engaging the Department of Health for the last 30 years at least, and to no avail. They're saying that the security measures are laxed at these hospitals. The security personnel only are equipped with batons where they're coming up with criminals, some of them with weapons there. It's not only them, Bradan. It's unions such as Denosa that I spoke to who reiterate the same sentiment, saying that for years they've been trying to engage the Department of Health without any luck so far. But what's scary is the stats around this and where South Africa is ranked in terms of the other countries and the safety of healthcare workers. It's scary to find out that countries like Afghanistan, it's much safer to be a healthcare worker in a war-torn country like Afghanistan than it is to be here back home. In the conversation that we had in that briefing with Sama, that's what they had to say.
is a failure of policy implementation by Department of Health. It's not a failure of a fund or a finance, because DOH last 30 years, SAMA has been informing them there is a huge security risk in public sector and private sector, even the clinics where the doctors and nurses are not safe. There are no policy implementation. It's not a cost issue. It's a very simple issue. The basic measures are not done. For example, they are not adherence with the national guideline of safety and security. It not aligns with the World Health Organization guideline. WHO had a very clear guideline for the hospital safety and security for the doctors and nurses. The basics thing, it don't cost that amount of money, like lightning, like cutting the bushes, taking out all the unnecessary gap, like many entrance and exit, which is unchecked. Basic instrument like security checking with the metal detector. Most of the time, those metal detectors are not working.